Hi, I'm Harry Rock, and welcome to another edition of the Westfield Council on Aging Presents. This is a special collaborative effort between Mike Squindo, Executive Director of the Westfield Senior Center, Tina Gorman, COA Special Projects Coordinator, and Pete Coles, producer of WCPC Westfield Cable Channel 15. Our topic is Medicare fraud, and my guest today is Lucilia Prates, and we will be discussing Medicare fraud, how to detect it, how to prevent it, and how to report it. So, Lucilia, thank you so much for coming in. We really appreciate it. This is a relevant topic, and just talking to you off air sounds like it's something that people really need to know about because there's a lot of it going on, unfortunately.
It's relevant. It's relevant. Thank you for having me.
Yeah, you're welcome.
And it's a pleasure to come out here.
Yeah. So how long have you been involved with this? You were on our show a few years ago.
I was.
But how long have you been working in the industry?
I have been doing this particular work since 2002.
Wow.
Which is going on 22 years.
Wow. So you know your subject matter.
If I don't, I have troubles, right? I say that to myself. What am I going to say? Well, if you don't know what you're going to say, you have big troubles.
Yeah, that's exactly right. And so obviously it's something that you relate to, that you find meaning and purpose because you've stayed with it. It's hard to find people that have stayed with these kind of jobs that long.
Yes, it's very meaningful.
Right.
And so the Massachusetts Senior Medicare Patrol Program is a national initiative. There are 54 programs like ours throughout the country and in the territories of U.S. Virgin Islands, Puerto Rico, Guam, and in D.C., a total of 54. I lead the initiative in Massachusetts, and I like to say to people that, well, our national mission is to reach, educate, and counsel Medicare beneficiaries on preventing, detecting, and reporting healthcare errors, fraud, and abuse. So that is the national mission for this program.
Say those three things again. Reach,
educate,
okay,
and counsel.
Okay.
Medicare and I like to say Medicare and Medicaid.
Okay.
Beneficiaries on preventing, detecting, and reporting healthcare errors, fraud, and abuse.
Wow.
Right? It's a big sort of scope, right? Big umbrella, if you will.
Right.
In Massachusetts, since I've been on board, my vision has always been to reach, educate, and promote health consumer engagement. Being engaged in one's health care. Because if you're engaged in your health care, you're much more apt to understand your health benefits eligibility, understand when you're going to go to the doctors, what you're going to the doctors for. Should I take my spouse? Should I take my child? Should I take my friend with me? It's always wonderful to have another set of ears, another set of eyes in the room.
Oh, that's great advice.
Yes.
Right.
So it's really about, so my vision has always been to promote healthcare engagement, people to be really engaged in their healthcare, so that they are in the know. I often say to people, you may never be the CEO of a company, but you are the CEO and president of your body, and you need to have discussions with your physicians. You need to understand what you're going to the doctors for. Do you need a certain procedure? Why is it needed? If it's not needed, what are the possible outcomes? People need to be really, really in the know and prepared before they go to the doctor.
That is great advice. I like that. CEO of your own body.
Well,
and really do your homework before you go in. So you know.
Write down your questions. We
Right.
do presentations across the state. We're a statewide program. There are people out there doing presentations today, and I'm here, right? But we could be on the tip of Cape Cod, Provincetown, or on one of the islands. In fact, we do have a volunteer on one of the islands.
Oh, wow.
And on Martha's Vineyard, we have a volunteer
Okay.
who does some of this work.
Yep. Oh.
And in fact did a presentation last week out there. So that prevents me from going. It's a real trek to get up to the islands. But it's a nice time to go now, but all the tourists are there as well.
Yeah, it's tough getting back and
But
forth.
so
with the
we
boat.
are all over the state delivering this message, this very important message about how do you recognize, how do you detect possible errors, fraud, or abuse, and then what to do about them.
Right.
Okay, but really understanding the healthcare system and how to navigate it, I think is so complex in itself, and it's part of our presentation that we do as well. So we'd love to come out and do presentations for any of the COAs or churches or any other, clubs, social clubs that people are associated with, and would like to invite us out, we'll come out and do it. We have volunteers out here.
Oh, that's great.
And we're always looking for some more. So if you'd like to volunteer, we'll give you that information shortly.
Yeah, that would be great. I want to back up just for a second. So at what age do people become eligible for Medicare?
So people become eligible for Medicare at the age of 65,
Okay.
or if they have been disabled for 2 years. So you could have a very young person on Medicare because they've been disabled for 2 years.
Oh, is that right?
Yeah.
Regardless of age?
Yes.
Oh, I
Yes.
did not know
There are
that.
other eligibility criteria. So, for example, you have to have worked 40 quarters, unless you were born with a disability, but your parents probably have worked it. But so there's other criteria, and I'm not the expert to answer those questions, but
Right.
certainly I'm sure that you've had Shine come out, and anybody who is looking for those answers should definitely contact their Shine program. Anybody who's questioning their health benefits eligibility or affordability should contact their local council on aging and see a Shine counselor, because there are ways that you can get some help that you might not be, you might not be knowledgeable about, but Shine will be.
Okay, that's great advice. So the Senior Medicare Patrol, how long has that been in existence?
So the program itself has been in existence since 1997.
Oh, wow.
Yeah. In Massachusetts, so in 1997, there was a pilot project with the 5 states across the country that had the largest number of Medicare beneficiaries. And essentially, they did a pilot to see if they educated consumers on prevention, detection, and reporting, if there were any results, right? And the results were there. So much so that Congress decided to fund the program.
Oh, wow.
So in 1999, the program went national. And in 2002, the program then, for every program that existed, it required that we go statewide. So that we were really reaching as many Medicare beneficiaries as possible with this very important message.
Yeah. And as I understand, as I was prepping for this, Medicare, I was reading this online that Medicare losses are estimated to be around $60 billion
So
each year due to billing errors, fraud, abuse. It's a shocking number.
it's a shocking number, and I tell you it's a conservative number.
Is that right?
Yeah, I think it's a conservative number. We've been using this number since I have been on board. So I'm going to say that we were given this number a long time ago. And that's the number we use because the Government Accounting Office puts out those numbers for us to use. And so that's the number we use until we get a new number. And I would say that the new number is probably
It's
higher.
grown, right? I'm sure it has.
Yeah.
Right. Wow. Well, let's talk a little bit about that. How is Medicare really taken advantage of? When you think about fraud and abuse, what does that mean, and how are they doing that?
Right. So there's errors. Okay, there's typographical errors, there's coding errors. There's just
So those
errors.
are natural mistakes.
Right, natural mistakes that are
Right.
made, by virtue of us being human, right? So those can be caught very easily, by having people look at their Medicare summary notices and their explanation of benefits and their billing statements and really questioning, did I go to the doctor on this particular day?
really
Did I
look at
really
that.
see? Yeah,
Okay.
look at that. It says this is not a bill, but it really does spell out what services one received. So looking at that and understanding, yeah, I did go to see Dr. Smith on, the 10th of June on my way to Westfield, okay? So but really encouraging people to keep track of everything. So I brought this lovely healthcare journal to show everybody. And you can get these at your local councils on aging. And if you can't, a number will be displayed, I think, for the viewers. But you can call the Massachusetts Senior Medicare Patrol Program and we'll gladly send you a journal. It's called My Healthcare Tracker. But if you say you want a healthcare journal, we'll just send you one. We'll send you one for your, significant other or family members, neighbor. We don't have an issue sending these out. We want people to really be as engaged as possible.
What is your experience out there? Are people really looking at their statement of history, essentially, of what's been going on? Are they
I think we're seeing a lot more involvement, a lot more engagement. I think in particular when somebody gets a bill for something that they were not expecting, then, they start calling. And they call a host of organizations before they sometimes end up with us because, not everybody knows about the Senior Medicare Patrol Program. Although, we've been around for 24 years, over 25 years now in Massachusetts. But so I would encourage people to always look at their Medicare summary notices and their explanation of benefits, write things down, ask questions. Obviously, if you're going to get a bill and you don't know that what you're paying for, or you feel it's not an appropriate bill, that you're going to be up in arms about it. What we've recently discovered is we have discovered that people have gotten bills for genetic testing.
Oh, wow.
People are getting bills for COVID tests.
Wow.
That was a big thing after the emergency ended.
And that's easy to hide.
Why not capitalize on this if I'm a scammer, right?
Right.
Everybody was getting these test kits in the mail, and Medicare was being billed for them. And so we don't even know if the tests are good. So my advice to people was don't use the test. God forbid they were laced with something, right? Don't use the test. Your doctor didn't prescribe it, don't use it. And
so they were receiving a physical test.
They were receiving kits in the mail.
Then they were being billed for.
Medicare was being billed for it, so it was coming out in their Medicare summary notice. There was a tremendous number of reports coming in throughout the country, including Massachusetts, and then we started to see, people being billed for intermittent urinary catheters. And those were not even being sent out. So I have a case sitting on in my file cabinet with cases, and there are many of these cases, but the one that really takes the cake is a $19,000 charge to Medicare for intermittent urinary catheters that were sent out over a series of several months to this individual, who never received them, by the way. I think that she would have, reported it immediately had she received them in the mail, but they were being billed. And she was not looking at that Medicare summary notice. So when we called Medicare about something else for her, they said, oh, what we're seeing here is, we're seeing intermittent urinary catheters. And so $19,000 later.
Wow.
Yeah.
Wow.
So please look at those Medicare summary notices. Although it says this is not a bill, they do explain all of the billing charges that have been made against your Medicare number. And that's really important. Keep track of. I tell people to save them. Put them in a binder. Punch 3 holes in them. Put them in a 3-ring binder. Keep them in chronological order. It's a good way to track tests that you've had or not had, fraudulent charges.
Right.
And if you ever need to report something, you've got the documentation there. We can get it from Medicare, but if you've got it there, it's a lot easier.
So how are these, I guess they're individuals or dummy companies?
There's a lot of phantom companies, yes.
And how are they getting people's addresses to mail this stuff to them or charge?
There's been a lot of breaches. We hear about breaches daily, right?
Right.
So there were breaches. They call people. We all get calls. I get calls all the time. I don't get them at home because I'm never there, but I get them at work on my direct line. And they want to know if I want brace. Oh, I get them on my cell phone. Do I want, does my back hurt? Does my arm hurt? Does my head hurt? There are days everything hurts, right? But they want to send you braces for every part of your body.
Oh, I
right?
see, right.
People receive braces, and they don't even know how to put the appliance on.
Oh, my goodness. Right.
So we have no business getting any brace from any company who's calling us. We need to get those braces or whatever apparatus we get prescribed by a physician who knows what he or she is doing, right? And is going to teach us how to utilize it. So people are calling and, sending things in the mail. And with the advent of artificial intelligence, I think we have bigger problems coming. And people need to really get prepared.
Right.
The grandmother scam. That's going on. Now they're recording people's voices. They want you to say yes. So don't ever say yes. Don't ever press 1, 2, or 3 when they're telling you to press those numbers. Whatever number, if you approve, if you agree, press 1, press 2 by an unknown caller, because that's giving them the liberty to do something.
We're in my own household with my wife, we are very suspicious. We've become very suspicious of all the calls.
It's unfortunate. We all have.
And so our practice, and it's probably not a bad idea for our listening audience to think about, is that we'll look on our phone and see the number. If we don't recognize it, we don't answer it. It will go to our answering machine. Then if someone we know is leaving their message, we'll pick up. But if we don't recognize it, we don't answer it. And I'm even to the practice now, if I see a number I don't recognize, I'll pick the phone up. I don't say anything right away. It's not like, hello, is this Harry? Yes, no. I don't say anything until I'm listening and I don't recognize a voice or it just sounds suspicious. Click, I'm done. Yep. I just hang up. But I used to be so trusting. I would answer any phone call that came in. Now our phone rings all the time.
Our phone lines have been taken over, our computer lines, our cell phones.
Yeah.
Don't click on links, Don't, be very cautious. Be very suspicious. It's unfortunate, but that's the way we have to be. I, too, don't answer my home phone unless I look at the caller ID.
Right.
But if I'm in a room where I don't have caller ID upstairs and I pick up the phone and it's somebody and, is this the lady of the house? I'm like, well, who? I hang up on that.
Right.
But is this Lucilia Prates? Who wants to know? Who's calling? Why are you calling me?
Right. Good question. Right. And I think your point about the links, I've said to my wife, we get these things, oh, you've won such and such. Click this and we'll be happy to send it right. No, there is no such thing as the free gift. Don't engage those kinds of things. Be very, very suspicious.
Once you've engaged, they keep your name. They keep your contact because they'll get you again.
Right.
There is no free lunch.
Yeah, no.
You're not going to win the lottery.
No, that's for sure.
So unless you've played.
Yeah.
Hang on to that ticket.
So one of the things I was looking at yesterday on the website as I was prepping for this is that, Medicare is being charged for services or supplies that weren't provided. You've just talked
Yeah.
about that. Misrepresenting a diagnosis, a person's identity, the service provided, or other facts to justify the payment.
Yeah, that could very well happen.
Right.
Right? And just wrong billing. And sometimes it's a mistake, as I said earlier, but sometimes I wonder, right?
Okay.
About we've had a case that where an individual went into a hospital and had a certain procedure that had to be done as an inpatient. The patient had it done as an outpatient, and Medicare was charged, and she was billed for an inpatient deductible because her insurance, she didn't have the upper level of insurance that she needed or a supplement. So that triggered her looking into this situation. And when we went looking, we discovered that the procedure that she had done should have been done as an inpatient and not an outpatient. And so the long and the short of that story was that the entity could not then bill Medicare because a year had exceeded. They actually wrote off they didn't write off. They cleaned up the mistake about billing her for the deductible. But they had literally billed her for room and board that night,
Oh, wow.
an itemized bill, and she had not stayed in the hospital. She had gone home after the day
Wow.
of surgery.
And
She
they
went home
still-
that evening, and she, because we asked for that kind of detail to look into the
Right.
case, and the long and the short of it is that the procedure she had done should have been done as an inpatient, but it was done as an outpatient. Now, my question is, well, was that done that way because somebody was, the facility was making more money, charging at an upper level, right? Charging under Part A,
Oh, I see.
right? And then, we did a lot of digging. It took a long time to figure this thing out because it was messy. But by the time we did figure it out, it was too late for the facility to bill Medicare at that point. Or they chose not to bill Medicare under Part B because it needed to be billed as an outpatient. So, and they returned the money for Medicare Part A to Medicare Part A. They returned it to Medicare. So those are the kinds of things we see. We look at the intricacies of that mistake, that case, and really tease it out and figure out what happened. Some of it's pretty straightforward. Others are not so straightforward. And it's hard to fix a medical bill. Very hard. Because, the billing department at whatever entity you're calling, they speak to you like they know exactly what's going on, right? Sometimes they don't. Oftentimes they don't. So, people really trust your gut, I say to people all the time. Our gut speaks loudly.
Okay.
Speaks loudly.
Yeah. So be aware of what's on those bills. And
Be
really look at
aware.
them.
Be aware what happened. Ask questions. Ask questions of everybody. Ask questions of your physician. Ask questions of the billing department. Ask questions of the doc. How much is this going to cost me?
Oh, that's a good.
Yeah.
Yeah.
He's probably or she's not going to know, but their office needs to know, or the hospital needs to know. They need to give you that information.
That's a good point. Because a lot of times, they tell you, well, you need this, we're going to schedule this.
Yeah.
We rarely ever ask what it's
Yeah.
going to cost. We just wait for the bill to come. And,
Yeah. And we're all guilty of it. I'll let you in on a little secret. I recently went to the eye doctor to get my prescription because my vision is declining. And I went in and I had the workup of workups, right? And I thought, oh, they're really doing a good job here until I got the bill in the mail, I have good insurance, thank you, God, but I should have asked more questions. Why are you doing this? What's this test for? I didn't see any doctor. I had a series of workups, a test, and then I went in to see the doctor. And I was quite annoyed by the time I went to see him because I had an 8:40 appointment, and I got in really, I was there till about 10:30. And I was not a happy camper, and he made that known to me. And I said, oh, I got to smile a little more. But the point was, it was my gut speaking to me. What was all that stuff for? And I should have asked more questions. We're all guilty.
Yeah, no, and you know what? We're trusting individuals, I think, instinctively, and so we think that the doctors and the medical system is there to look out for our benefit. So we go in trusting that whatever they're suggesting we need, that's the best thing, the best course of action, and who are we to question the experts?
I'm going to take that advice for this eye visit.
Yeah. So prescribing, I think what you were just talking about, prescribing and providing excessive, unnecessary test services.
I think I might have had some unnecessary tests.
Right.
And
I'm sure we probably all have had that.
Yeah.
Right. And it's all about diagnosis. Well, we're still not sure. We need to schedule another test.
And it was like an assembly line. In retrospect, I'm just thinking about this now a little bit more intensely. It was from one person to the next. Everybody had a test to perform, like 3 or 4 tests, until I got to see the famous doctor.
Yeah.
I should have asked more questions. Why is this needed? I need to speak to the doctor first.
Right.
Yeah.
Let's talk about
next time.
Next time. Now we know. Let's talk about medical identity theft, and that's when your Medicare number, much like your Social Security number, has been compromised or stolen.
Yeah.
How often does that happen, and how does that happen?
Well, that's happening a lot, right?
Okay.
That's happening a lot. Anybody who's getting, intermittent urinary catheters prescribed when they don't actually need them, that number is compromised. Anytime something is charged to our Medicare number, right, and it was an odd doctor or a facility that we actually went to, that's outright fraud, right? And our numbers have been compromised. Medicare numbers have been compromised, right? So that's medical identity theft. What concerns me mostly about this is that with the advent of electronic health records, everything is on, electronic right now, right? If somebody gets a hold of a diagnosis that is really not your diagnosis or diagnoses, then how does that get, factored in? So I'm actually going to be launching a task force made up of healthcare providers from healthcare clinics and private offices and hospitals, whoever would like to join. We're going to be launching this later in the summer to look at the number of requests that come in to doctors' offices to sign off on things that have no business going to the doctor to sign off on them. Because what they're doing, some of these phantom companies, is what they're doing is they're actually sending these authorization forms to be signed off, just randomly sending them to the physicians of, Lucilia Prates, Harry Rock, and the like, anybody and everybody. Physicians. Now, how are they getting that information is a good question.
Right.
And we haven't really, I don't have that answer.
If a person's number is compromised, what do? Do they get a new number?
They can get a new number.
Or they can.
So whenever they call us, we say to them, yes, you can call Medicare, and you can say, my Medicare number has been compromised, and I would like to get a new card.
And all the information, all the records that are on the old number, does that get transferred over to this new number?
That gets transferred by, Medicare takes care of that on their end.
And the assumption is that whoever has gotten access to your file, they can't follow the transfer of information.
That's the assumption.
And the hope.
The hope.
Right. So be really careful about your number, much like your Social Security number.
Yes. And your credit card number.
Right?
You wouldn't randomly give that out. So you can't do that with Medicare number either. Yeah.
Yeah, that's
it's a real problem.
Yeah. Yeah, no, to your point, I hadn't even thought about credit cards, but you're right. Those are the numbers that they're looking for. I was in a doctor's office recently, and I had to fill out a new form because it was a different doctor. And in the form that you're always filling out, what's your Social Security number?
Yeah.
And I'm thinking,
You don't need that.
why do they need my Social Security
They don't
number?
need
I don't
it.
fill it out.
They don't need it.
So, lesson learned, if you don't feel it's appropriate for them to know that information, don't fill it out just because it's on the form. Don't fill it out.
Right.
Right. Just
I don't give
them
my
the
Social
basic.
Security number out to anybody.
Right. Yeah.
You know, I just don't.
Yeah, you can't.
You know.
Right.
Because there's so, identity theft is such a big problem, And, this, people might be thinking, oh, this isn't going to happen to me because I take such good care of, keeping things under lock and key. It's not going to happen. It's going to happen. It's a matter of when. It's a scary thought. But it can happen to any one of us. Any one of us can be taken by one of these scammers.
And if they get access to your Medicare number, I'm guessing they then have access to your Social Security number because your Social Security number is part of your Medicare file. Correct?
Well, but they're not going into the file.
Okay.
I would say that's highly
still
unlikely.
Okay.
Highly
okay.
unlikely.
That's good to hear. Okay, so they can't get access to that.
Yeah. No, they're getting access to a Medicare number through, I don't know how they did it, but data breaches happen all the time.
Right.
I was sharing with you before we were on air. I was just driving out here, and I live in Arlington, Mass. And the town of Arlington has been taken for $450,000 by a vendor who, or vendors who allege that they're associated with the building of the new high school. And all I could think was, there go my taxes.
Yeah, right.
Right?
Because somebody's got to pay for that.
Somebody's got to pay, right?
Right.
So this is happening everywhere and to everybody. So we just have to pray that, it doesn't happen to us.
Yeah. No,
And stay really alert to, our different bills and in particular our Medicare. This is problematic because we have to protect our medical identity from, we don't know what the next scam is going to be, right? And they are, 10 steps ahead of us.
Right. Yeah, unfortunately. Yeah, they're very sophisticated. They've been thinking, this is what they do for a living.
Yeah. This is, on some level, this is even organized crime.
Yeah. No
That's happening in the United States, outside the United States, and we just need to be really vigilant, very vigilant.
So let's talk about how others can help identify fraud that's going on. So as I was reading up on this, caregivers, families, partners, professionals, healthcare providers, a community.
It takes a village.
So can you talk to that? I love that.
Yeah.
It takes a village.
Yeah.
So what does that mean?
That's not my terminology. I think that was...
That's been around for a while.
Yes.
But it's a great
But
phrase.
it takes a community,
Right.
right? So I think that being an older person and having health issues, right? Having health issues is challenging, right? Being an older person with health issues, right, is even more challenging. So I think that it's really important, if we're caregivers, to really understand the plight of our loved ones, right? And to be able and ready to be there for them at their asking, right? To, can I help you with your Medicare summary notices, Mom? Let me help you out. Let me look at this. Let me sort through this. Keeping an eye out for them. What's going on? It's a way of educating ourselves maybe as to what's going on with them health-wise. And get, it's a good time it's a good use of our times to be spent with them sometimes maybe. I know I used to do this stuff for my parents, and I wish they were still around so that I could, continue to do it. But it is overwhelming to be sick and have to deal with navigating the healthcare system and the bureaucracy of the healthcare billing system. And if you're older, I think that you've got Medicare, you've got Medicare A, Medicare B, you might have a supplement, and then you have your drug plan, and you might have a rider, which we were talking about earlier. And it's a lot of moving pieces, right? And any one time that you go to the doctor. So people need some help with this. And so I think we need to be at the ready to help people, right? Whether we are, a child, or we're a spouse, or we're a grandchild, or we're a good friend or neighbor. I think it's always nice to do things for others and to think about how we can help somebody navigate this mess. So if somebody tells you that, I went to the doctor and this happened or that happened and something sounds questionable, to pursue that conversation. And to, figure out when they get their Medicare. When you get your statement from Medicare, let's look at it together. Let's look at the bill. I think we need to be more involved and more aware.
Yeah, I think that's great advice. And if you are by yourself because all of your family has passed away and you're moved, it's
or too
okay
busy
to
living
ask.
life.
You should ask other people to
Yes.
step in because it can be very confusing.
Yeah.
And as you get older, I know myself, fortunately, my wife loves taking care of paperwork. I can't stand it. If she wasn't in my life, I cringe to think about what situation I'd be in trying to get through all that paperwork. So it's good to be able to reach out to someone that you trust.
Make sure you trust that person.
To help you.
You would trust that person knowing your business.
Right.
You trust that person, knowing your social security number, your Medicare numbers, all of that stuff, right? It's got to be somebody you know and trust, right?
Yeah, that's a great point. All right. So if somebody suspects something.
If somebody suspects something, we're there. The S&P program is there to help.
So who should they call directly?
They can call our 1-800 number, 1-800-892-0890, and ask for the Senior Medicare Patrol Program. The number people are calling is an age span number because we are under the leadership of Age Span, formerly known as Elder Services of the Merrimack Valley and the North Shore.
And you cover the entire state.
We cover the entire state.
Right. So if
our
out
office
here in Western Mass, they can still call
Our
you.
office is in Lawrence, Massachusetts, but we cover the entire state of Mass. And please do not hesitate to call us if you have a question. No question is stupid. You shouldn't be ashamed of asking any question at all. This is hard stuff to figure out. And when you're sick, who wants to deal?
Yeah.
That's the last thing you want to deal with when you're sick, right?
Right.
Is a bill.
Yeah, you just want to focus on trying to get better. So for people people need to learn more about Medicare fraud and how to protect themselves, where can they go to find that information?
They actually should definitely connect with the senior center. And if you think that you'd like to know more about this, ask your senior center to invite the S&P program to come out and do a presentation. And we will gladly come out. We have people out here, volunteers that work out here. Or one of us will come out, one of our staff people will come out and do a presentation. Okay. And our presentation goes to, really does, go into examples of errors, fraud, and abuse. It explains to people what errors, fraud, and abuse look like. And I think we've covered some of that here.
Right.
We also go into, the engagement piece, understanding, for example, when an ambulance might be paid for or not be paid for.
Oh, that's good.
We also do a presentation on that. The other thing we talk about is we talk about inpatient status versus ambulatory status, and how people really need to understand that, especially if they're on original Medicare, Medicare A and B and a supplement, and how that might play out. What are the financial consequences if you end up going to a skilled nursing facility for rehabilitation and you haven't met your 3 midnight rule for Medicare? So how that might play itself out. So there's we talk about the CARE Act. We talk about a lot of different things that people really need to understand to be better engaged.
Well, I'm sure we will, knowing our senior center is engaged as they are, I'm sure if they haven't, they will be providing some kind of an outlet on this.
Yeah.
So 3 steps to the senior Medicare patrol. Prevent, detect, report. Can you talk to all 3 of those
Yeah.
steps?
So I think preventing is really understanding what it is what you're having done, right? Looking at your Medicare summary notices.
Okay,
to
just what we've been
detect
talking
what we
about.
talked about,
Right.
and then reporting, calling us with whatever issue that might be. So when we get a concern from a beneficiary, we enter a whole lot of data into a national database related to the individual, including the Medicare number. So we will ask you for that. And we will ask you for copies of your Medicare summary notices that speaks to the complaint that you're calling us on. We ask you to sign a release of information form so that we can call on your behalf.
Okay.
So we could call, the doctor and they'll,
So you will call.
Yeah. Oh no, we do a lot of digging. Yeah, we do a lot of digging for the individual, and then so once the problem gets resolved and the money is returned to Medicare, then what we request that the individual do is send us a copy of that adjusted MSN, Medicare Summary Notice, that they get from Medicare, saying the money has been,
Right.
It's now a zero balance, so
Right.
that we can demonstrate to the Office of the Inspector General that we followed through on this case and we closed it out. Yeah.
Oh, that's
So
interesting.
so we monitor from the beginning to the end
Okay.
to make sure that the individual gets, that the money gets put back into whatever was been paid out by that number, right? Gets returned to the Medicare fund.
Okay. But people should not have any hesitation or intrepidation about making a call and saying, "I need some help."
Absolutely not. We encourage that.
Right.
We encourage that. We might even guide them and say, you know what, you can call your own doctor, you can do this, you can do that, and give them some leads on what they can do. But we are at the ready to take on any case. And if it's a case that it's not appropriate for us to take on, we will say, you know what, this isn't ours. So, for example, I'll give you an example of that. Somebody calls us about a quality of care complaint. Because errors play themselves out in dollars, but errors can play themselves out in devastating health outcomes, right? So you need to be really attentive. What's happening to you in the hospital as well, right? So quality of care is another concern that we address during our presentations. And if someone has a quality of care complaint, then what we will say to them is, you know what, we want you to call Kepro. And we'll give you all of that information. In fact, some of that information is in the journals that we give out. And we ask people to call Kepro and to report that mistake or that infection or whatever happened to the individual in the hospital.
Okay.
Okay?
Yeah.
So people call us and we're there to help you. I just want people to understand that. The Massachusetts Senior Medicare Patrol Program is there to help.
Well, that is good advice. Are there any other things that people need to be aware of, or tips that you would want to share with them that they should be concerned about in trying to protect themselves and to be really advocates for themselves and to be aware of what's going on?
Yes, don't give out your Medicare number. No, if Medicare calls you,
That's a good one.
don't give out your Medicare number. If Medicare allegedly calls you, it's not Medicare calling. It's somebody pretending to be Medicare, and they're going to send out gold cards. They're going to send out plastic cards. They're going to send out, the card of a lifetime. That's not happening. Medicare's not sending out new cards. Okay? Those lines are used. People are called all the time, asking them for their Medicare number, to confirm your Medicare number because we're sending this out.
Oh, really?
If somebody called you to confirm your credit card number, would you confirm it? I hope not. Right? Don't give out any personal information to anyone you do not know or trust. Do not give out any personal information to someone who calls you. If you're calling somebody, if you're doing the calling, you're initiating that call, then somebody asks you, well, what's your credit card number? Obviously, because you're making a purchase possibly, you're going to give them that number. But do not give out personal information to anybody. That's the best thing you can do. Now, with data breaches, there's nothing anybody can do about that. Right? Those are inevitably going to happen. They happen daily. There's a data breach going on right now and we don't even know about. Right? So that's, we just need to be vigilant. We need to be looking at everything that comes in the mail and shredding.
Oh, that's a great point.
Shredding.
Yep.
Right? Don't just throw it out in the trash. Now, you can spend all weekend trying to do that because I feel like I do that. It's like, a good hour of my weekend goes into cleaning up junk mail that I don't want to receive.
Yeah,
but my name's all over it.
Yeah.
Right?
I always wonder how they get our names for all this.
They get our names. And, the whitewashing of checks now that we have to deal with. I no longer put anything in the mailbox. I now go to the post office to mail. I pay very little by check.
Oh, that's interesting.
Or, a birthday gift. If I send someone a check, it's going to be either a gift card and hope that doesn't get stolen. But, or I send a check, but I go to the post office and mail it. Inside the post office, not even outside the post office, because we hear about that all the time.
Yeah, that's a great point. How do people, we are developing a very suspicious society, and we need to be.
Know.
So there are legitimate calls that are coming in. How do we know what's legitimate and what's not? How do we? What are some tricks that we?
Well, if I had the answer to that question, oh boy, I wouldn't be sitting here.
Yeah. So how, if a doctor's office calls you and you're saying, I don't know if you're the doctor, how do you know that it is or not?
If my doctor's office calls me, I would say, I'll have to call you back. And I would call my doctor's office, not a number that they give me, but my doctor's office, and say, did somebody just call me from there? Okay. That's what I would do.
Yeah, that's actually a good point.
I wouldn't take their number because you can be a scammer and give out any number to people. Right?
Yeah. And that's the frightening thing, is how much information people have on us, I guess.
And they have a lot. Yeah, they do. They have a lot of information.
Right.
And you know what? Be careful what you put on social media. Right?
Talk about that for a second, because social media is something that, again, we tend to be very innocent about, but it is easily taken.
So grandparent schemes, I think a lot of this is happening because they know.
Explain what that is.
Grandparent schemes is when someone calls an individual who might be a grandparent. If they called me, I would say, you got the wrong person. See you later, buddy, because I don't have any grandkids. However, if they call a grandparent, somebody who's legitimately a grandparent, and they say, hi, Grandma, this is so-and-so. I'm calling you because I'm in jail, or because that's typically what happens. Somebody got into a car accident and they're in jail or in the hospital, but they're in a foreign hospital and they need $10,000 or what have you, right? And and the person gets, they get you at that moment, that angst that you're feeling, and, and you'll do anything to save your grandchild, I suppose, if you have grandchildren. But they know the grandchild or grandchildren's names. And how do they get that? Probably Facebook.
Yeah. Because
people put a lot of things on Facebook
right.
that they really need to, stop doing or slow their use of it or not be as transparent.
That's a great point.
Yeah.
Yeah. So you're hearing about people having their privacy invaded.
Oh, I know people who that has happened to personally. I know somebody who was at her computer, very intelligent person, by the way, at her computer, and the computer, Word sent her a message that everything, her hard drive was going to blow up, essentially, right?
Right.
And but somebody could help her out, and it was after hours, so she had to go and buy gift cards to pay them through gift cards. And she went and did that.
Oh, my goodness.
She went and did that because she was so afraid of losing all of her data on her computer.
Right.
So something happens on the computer, and you get an alarming notice from Microsoft Word, that your hard drive is going to blow up.
Right.
Turn off the computer.
Right.
Call somebody run that by them, go, to Best Buy or somewhere else, or this is not endorsed by Best Buy, by the way. Go somewhere. Go to a local
Right.
person who can help you out.
Right.
With figuring out what's going on with your computer, but don't give out any money. Don't run around buying gift cards to send to people. The grandparent scam is done very much that way, too. You go get these gift cards, and then you scratch the gift card, and you give out the numbers, and don't do that. Just don't fall for that. And if anybody who gets that kind of a call, the call is, please don't tell mom or dad.
Oh.
That message is in there. Well, call the person back. Call your grandchild and say, middle of the night, call your grandchild and say, did you place this call? He's going to answer the phone, or she's going to answer the phone and say, no, Grandma, I'm home. I'm talking to you.
Right. Yeah. No, that's great.
Yeah, they
great
get
advice.
people when they're, when their guard is totally down, too. This is a big one that we're seeing. We don't do a whole lot with scams, but we hear a lot about them. But AARP has a great program with scams, and I'll give you that contact because you might want to have somebody out here.
That's great. Well, this has been a fascinating conversation, and unfortunately a necessary one. Not a topic that we care to talk about, but
no, but
definitely have to know about it.
Yeah, and it's good to be informed, right?
Right.
So, point I want to leave: use a personal healthcare journal, right? Write down your visits, write down your plans.
So what's in that?
What's in here? There's all sorts of wonderful information in here. There's 5 questions you should always ask your physician.
Okay.
Okay. There's an immunization record
Oh, wow, that's a good one.
for one to keep. There's care plans, appointments. Who do I have my appointments with? There's a host of those pages, so people can keep all their chronological appointments in here. There's an area for notes, and there's very important numbers that everybody should have. So there's a wealth of information in here.
And they can get this from the senior center.
They can get this from their local senior center, and if their local senior center doesn't have it, they can certainly request it, and I'll follow up with Tina, make sure she's got some.
Yeah.
And if they want to call us directly and ask for one, we will mail them out
Okay.
to the individual, and I will leave this one with you.
Oh, that's great. Thank you very much. So definitely everybody, see if I can get this, I gotta go backwards here and get the glare off it, but yeah, let's check at our senior center, see if we have them, and if we don't, talk to the staff and see if they can order these, but or you can order it yourself, but you should definitely have them.
Definitely. So that is the beginning of preventing,
Okay.
right?
Right.
Looking at Medicare summary notices is really important, an explanation of benefits. Understanding them. They're not all that hard to decipher. Make sure it belongs to you when you see it,
Oh, good point.
right? Is this really mine? Is my Medicare number on here? Is this my number? And did I really see these doctors? I can't believe this charge. Or you might say, I can't believe Medicare only paid this. But look at it. Make sure that it is yours.
Right.
And those charges are applicable to your visits that you went,
And don't assume that they are correct.
Right.
Right.
right? So mistakes are happening. People are human. They make these mistakes. Medicare is processing hundreds of claims per second. So mistakes are going to happen, right? So they need our eyes on this as well. They need the beneficiary eyes on this.
Yeah.
And then there's the outright fraud of, the braces that people are being called about. And, they're more than willing to send them out. And they're going to be sending them out. That could hurt somebody down the road if they really do need a brace. And they've already received the brace. Medicare is not going to pay for the next brace.
Right.
So be careful.
Oh, that's a good point.
Yeah.
Right.
If it's already been given to you,
Right. And I know that at our Westfield Senior Center, Tina Gorman has a room filled with medical equipment that you may be able to use with walkers, or I'm not sure if she has braces, but you never know what she's got in there.
she might have some
So-
braces.
Yeah, she may have. So I would definitely, inquire with the staff at our Westfield Senior Center to see if they have any of the equipment that you need before you purchase it. And then make sure that you know what you're purchasing and that you purchased it and that you
And
have
that
it.
it's prescribed.
And that's prescribed. That's a great point.
prescribed by the doctor
Right.
that saw you for that
That's-
elbow pain.
Yeah, that's
Because
a
you know what? You could be putting on a brace on that elbow that's going to atrophiate some muscle.
Right.
Right? You don't want to do something without a doctor's prescription, recommendation,
Right.
and being followed. You don't want to do that.
Yeah, no, that is terrific advice.
And don't give out your doctor's name to anybody who calls.
Right.
The brace people who might be calling. And, we'll send this to your doctor. What's your doctor's name? Do not give that information out. That opens up a whole other can of worms.
Wow.
Be very suspicious
Yeah.
of all the calls that you get. Unfortunately, this is where we're at.
And I'm writing that down. Be suspicious.
Yeah, well,
I think that's really, really cool.
don't quote me.
Lucilia.
Cautious.
Yeah, I know it.
Be cautious.
Yeah, Lucilia Prates from the Medicare fraud program here. Thank you so much for coming in and
You're so
driving out
welcome.
from the
Thank
eastern
you.
part of the state. We appreciate your sharing your knowledge, your expertise, and your willingness to help our clientele, our seniors.
We have a group of dedicated volunteers,
Yeah.
right? I made my pitch earlier, but we have a group of dedicated volunteers. Our caseworkers who work on these cases are volunteers, and they do not leave a rock unturned. They really do follow. They follow the dollar, they follow the money, they follow the errors. They really do. They're working on behalf of the beneficiary. Even when I say to them, well, you know what? That is the Medicare rule. But don't you think, I taught them too well because that used to be me. Don't you think? And I say, okay, try it, see what happens.
Right.
What if we appeal, right? Go ahead, try to appeal. So they're always working to the advantage of the beneficiary. We have a volunteer out here in Western Mass who really felt that an individual had been treated unfairly about a charge that he was getting for a medication to the tune of $39 and some odd cents. And she worked on that hours and hours. Well beyond the $39, but she got the $39,
Good for her. Right.
returned to the gentleman. And he was, he sent me this little note, he was so grateful, just how she was like, she was just, so committed to doing that. I wanted to say like a dog on a bone,
Right.
but she really, went to bat for him, and he got his $39 back.
Sometimes what they've learned, scammers have learned, is if they don't charge, if a large dollar amount that'll trigger a red flag, but a small amount, $30, $50, you're thinking, well, I must have had something like that. It's not enough to really.
This was a drug company,
Right.
A drugstore that, provided him with this med and was charging them this amount of money, and it was borderline legit, really. But she went to bat for him, and she got the $39 back. So not everything is fraud. We see a lot of fraud. We're seeing a lot of fraud. I told you about the braces and the genetic testing, and the COVID tests that we were seeing, and now the intermittent urinary catheters, and God only knows what's coming down the pike next, right? But I'm sure somebody's thinking this through. So we see a lot of that. But there are always errors. And people really understanding the health benefits eligibility is a really important thing. And we would love to come out and do presentations for individuals, because I think that's another way of preventing this from happening.
Right.
Because the more you know, the more well-equipped you are to help yourself and help others.
Right. Well, I want to remind people that if you need help, you can call 1-800-892-0890. Again, that's 1-800-892-0890, and ask for the Senior Medicare Program. They will help you work through this if you've got questions, if you need advice, and if you need someone to sit with you, they're there to help you with that. Don't forget, and I loved you came out with some great sayings here. You are the CEO of your own body, so know what's needed, understand what you're asking to have done, make sure that you are okay in getting the kind of treatment that they're prescribing. If it doesn't sound right, second guess it. Make sure that you know what you're getting, and make sure that you're looking at those statements that are coming out to make sure that you actually had those tests. And sometimes they're confusing. Don't be afraid to call the hospital or the doctor's office to just say, can I just ask you what this is? I've done that myself when it looks confusing and I'm not sure what something is. Even on your credit card bill, you should be doing that. Look for the charges that you don't understand. Make sure that they are relevant, that they applied, and that they truly were given in good faith. So make sure that you're looking for that. And ask what it's going to cost you. I think that's great advice, because I don't always do that. You just get something prescribed. You just wait to see what the bill's going to be, so ask ahead of time. And shred any of your documents. Be careful to protect those numbers, not only your credit card number, not only your Social Security number, but your Medicare number. And I think mostly be suspicious. We are a trusting society, but there are those out there that are trying to take advantage of us. If you see a number that's coming across on your phone ID, don't answer it. If you don't recognize it, let it go to voicemail. If it's someone you know, then you can pick it up. But if it's not, if they are calling for reasons to take advantage of you and you don't answer, they don't generally leave a message. So you know right then that was not a legitimate call. If someone wants to leave a message for you because they truly want to get in touch with you like a friend or family, they'll leave a message. So be very suspicious on the calls that are coming in. And, and again, this fine woman here, Lucilia Prates, she's in your corner. She will help you, and her team will help you if you need any help.
Yeah.
And if any questions come up, go see our staff at the Westfield Senior Center, and they can help you navigate this system. So, Lucilia Prates, thank you so much for coming in. We really appreciate it. This has been a whirlwind of information, but really critical stuff for our people to know. So special thanks to Pete Coles, our WCPC Westville Cable Channel 15 manager and producer, for his help and support to make the show possible. And on behalf of Pete Coles, Mike Squindo, and Tina Gorman, I'm Harry Rock, and this has been another edition of the Westville Council on Aging Presents on WCPC Westville Cable Channel 15. Thanks for tuning in, everybody. We'll see you on the next show. Thanks.